Assalamu alaikum warahmatullah. Today we will be discussing the vision potential eye-related problems secondary to hypertension or raised blood pressure. Blood pressure is persistent high blood pressure or an acute rise in blood pressure can lead to different eye-related problems. First and foremost is hypertensive retinopathy. This is a vision-threatening problem in which the persistent high blood pressure or a chronic high blood pressure can lead to decreased vision. It mainly affects the small blood vessels that are supplying the most important part of your eye, that is retina. That can lead to decreased blood flow and hemorrhage, and that will lead to decreased vision. There are different grades of hypertensive retinopathy depending upon the severity of the hypertension and duration of hypertension. It is very important to control and maintain blood pressure in its normal range to decrease this eye-related problem. Second most important thing is vascular occlusions. There are different vascular occlusions in which blood vessels, either the branch of the retina or the central retinal vein can get occluded secondary to high blood pressure, and that indirectly leads to increased thickness or edema of the most important part of the retina, that is macula, and that indirectly leads to decreased vision. It can be a very severe problem if it is not treated on time, can lead to painful blind eye. So it is very important to keep check on your blood pressure. Third important disease that is related to high blood pressure is choroidopathy. This is a condition in which there is abnormal fluid buildup or edema in the choroid as well as in the retina. That is again secondary to chronic high blood pressure. Fourth important problem is optic neuropathy secondary to hypertension. In this condition, there is sudden decrease in blood flow to the optic nerve that transmits all the light from your eye to the brain. That can lead to edema and swelling of that optic nerve, resulting in decreased vision. These are the most important eye-related problems that are secondary to high blood pressure. That can be either an acute rise in blood pressure or a chronic blood pressure. So I recommend all the persons who are hypertensive or who are more than 45 years of age, they should get regularly screened from their eye specialist, especially a retina surgeon, to get their retina evaluated. And the patients who have high blood pressure or hypertension from so many years, they should get their blood pressure checked and monitored from a physician as well as an eye surgeon so that their vision remains intact.